Okay, we are almost through all of our different types of stims. So we really only have two more that you're going to be responsible for, and these two are very related to each other. And so this one we're going to talk about now is interferential, or what we call IFC. And interferential is really another use and another type of the pain control type of stim that we've talked about. So it's really kind of like TENS, but on a higher frequency. So our uses are really, again, our pain relief. We can target the level 1 and the level 3 pain control with our IFC. We can't get level 2 because, again, the pulse duration, we're talking about a medium frequency machine again, just like our Russian that we talked about with our NEMS. And so the pulse duration is going to be preset. And so because we can't get that pulse duration long enough, we can't target those C fibers. So we're really in level 1 and level 3 pain relief. It's not really great with muscle re-education because of, again, kind of the low pulse duration. But it allows us to use higher intensities and get deeper penetration, but at a more comfortable level. So people tend to like the sensation of IFC better than even our biphasic TENS sensations. Because, again, we have that medium frequency, we're able to overcome resistance easier and, again, get deeper penetration. Now with IFC, we're always talking about 4 pads. And because what we're doing is now, so far all we've been talking about is coming out of one current and kind of one channel from the machine, and then that's split into 2, or we split one and do the bifurcated, or you can do 4 pads, but you actually still have 2 currents and you would set up those treatments separately. Here, those 2 currents are interrelated to each other, so the 2 channels work together. Because what happens with IFC is we have 2 circuits that are going to be at slightly different frequencies. So in your packet of notes that's up on Moodle, you can kind of follow along with the constructive and destructive interference. And there's also another video that you should have watched that explains that constructive and destructive interference. But basically what we're dealing with is the fact that those 2 channels are going to have 2 different circuits that are going to be slightly different in frequency from each other. And so you're going to have these 2 separate channels that are going to work together. So by taking one circuit that's delivering a constant current at a certain frequency, and then using a second current and circuit to deliver a current that's at a slightly different frequency, it allows for interference. And so we talked about in that video about constructive interference and destructive interference. So constructive interference, full constructive interference, were when those waves were in sync with each other. And so now you would get double the height and double the fall of the waves, and they added together. Destructive was when they were completely out of phase with each other. So when one was going up, the other one was going down, and then they canceled each other out and you don't get any waves. What we use is what's known as continuous interference in IFC, where the waves are just slightly out of sync with each other. And so we get more exaggerated directions certain times, and then other times we have less. And what happens in the body when these 2 currents are added together, the interference happens in the body, and we only sense that difference. And so what we're going to be able to set is what we call the beat frequency, which is that difference between the 2 frequencies. And that's how we're going to get our results. So it allows for that interference to occur between the 2 circuits when they're superimposed over each other. And that happens with IFC inside the body. Like I said, that beat frequency that we set is going to vary, and it's going to vary based on our goals. And so we'd set our beat frequency based on if we want level 1 pain control or if we want level 3 pain control. And the body perceives it as a single wave. So that beat frequency becomes the difference between the 2 frequencies. So our effects, we get pain relief. We can potentially get the motor nerve stimulation if we're trying to do level 3 pain relief, which can potentially help with some muscle spasms. Again, there's debate on whether you can really do muscle re-ed or edema control, but mainly we're doing our pain control with our IFC. The advantages here is because of that medium frequency, we can get to deeper tissues. Also, because we're using the 4 pads, we can really target a larger area. And that larger area can be really important if we're trying to target kind of muscle soreness or something in the back or the quad. It does some good stuff kind of 3-dimensionally, going through the knee and through the shoulder if we have some deeper issues there. It tends to be more comfortable for people. That medium frequency and the narrow pulse duration allows better, it kind of reduces the skin's resistance. Disadvantages is just like all of our TENS and all of our STIM is it doesn't cure the problem and it could mask a more serious problem. It's also not portable. There's a couple companies that do an IFC portable. We don't have any of them, so it's less likely to be portable than a TENS unit. Indications are pain, and especially pain over large areas or deep areas, and muscle spasms. By decreasing the pain, we break up the pain spasm cycle. Contraindications, all of our same contraindications and all of our same precautions. Our steps are all the same. Our explanation, you have to be able to explain the IFC and kind of the constructive and destructive interference a little bit. You have to be able to explain your pain control levels, so level 1 or level 3, so what's happening in the body for that. As far as the sensation goes, same sensations. Level 1 is going to be the pins and needles, level 3 is going to be the pins and needles, and then to a muscle contraction. Same thing, reassure them, make sure that they're comfortable with the treatment, make sure that the pads are attached correctly, all of our same steps that we've been talking about throughout. And then when it comes time to actually get the equipment going, so turn your machine on, set your pulse rate, which is really our beat frequency is what we're setting. So for our high rate, our level 1, we're going to set that between 80 to 200, again, maybe between 60 to 120, depending on the book you use. If we wanted to do our low rate, our level 3, we would be, again, low, so 1 to 5 or 2 to 10, depending. And then we would want the muscle contractions for the low rate, and we wouldn't want the muscle contractions for the high rate for our level 1. Other things you can set on our IFC that you maybe haven't been able to set before. Now, some of these you can actually set on biphasic as well, but they're more commonly seen with IFC. So the first one is what we call a scan. This is when the machine automatically changes the beat frequency within a pre-selected range. So again, some of our machines let you also do this for biphasic, for our typical TENS. And this is a way to modulate. And again, it helps to overcome the accommodation idea and the habitation idea. So basically, as the machine is turned on, if you set a range, so 80 to 200 or 60 to 120, as the treatment goes on, it will automatically change itself and run from 60, 61, 62, 63, all the way up to the 120 and then back down and then go up again and back down. And what that does is you actually get to scan between all those frequencies, and the body can't really get used to it. The nerves won't, the ions won't flux and kind of dissipate away. It actually kind of keeps the cell membranes guessing, if you will. So that's the idea of the scan. So you can usually set those ranges, or you can just set a fixed, which is just like we did for our biphasic. You pick one number and that's what you go with. Then you also have, it's called different things on different machines, the vector, the target, or the sweep. And what this is, it represents the percentage of decrease from the maximum amplitude. And so it's often referred to as a percentage, or it can be referred to kind of the perceived movement of the field. So normally when we set up our IFC in our 4 channels, right, our 4 pads, we're going to have one channel want to cross and another channel cross so that the center is right where the pain is located. Sometimes we have a really discrete area, and so we'd want things very small and in that area, and sometimes we want a really large area covered, and so then we want a larger kind of clover leaf. Think of it like windshield wipers. As that current goes through, it kind of windshield wipes towards the other pad, and so we can expand our treatment area. So it can be a percentage, 100%, 40%, 20%, or again fixed, where we would just want it at that center point of the treatment, so there's no movement in the field. Or we can set it as an area, large, medium, small. Sometimes it's also called shallow, medium, or deep. So if we want a small area targeted right around that center point, if we want a large, or if we want it to be really shallow or medium or deep, and it produces the perceived movement of the IFC field. So again, if you do a higher sweep, usually you get those larger clover leafs, but you also get a lower current density. And so it tends to feel less over a larger area versus more intense over a single spot. Like we said, the electrode placement is always quadpolar, and you always want the channels crossing in an X. And that allows for that superimposing of the frequencies. As the currents cross, they begin to superimpose, and it will form what we call a clover leaf pattern. So you can see that in the notes up on Moodle as well, what that clover leaf pattern looks like. And that clover leaf pattern is where the beat frequency is occurring. Length of time, 20 to 30 minutes. Application 1 to 2 times a day based on pain levels. And then all of our post-application steps are all the same. Last one that you'll be responsible for as far as doing your skills on is what we call pre-modulated or pre-mod. So a pre-modulated current. And this is the same concept of as IFC. We have 2 separate waves that are produced and summed. But instead of it being superimposed in the tissue, in the body itself, it's superimposed in the machine and then sent out only 2 pads. So it's often called IFC in 2 pads. So it gets summed in the machine and then put out. So it's useful in when you want the effects of IFC, but the area is too small for treatment with all 4 pads. So all of our effects are the same as IFC. All of our advantages, again, we get the deeper tissue. This one has the advantage that we can do a smaller area over IFC. It's just like IFC, usually more comfortable. Disadvantages, all the same as our IFC was. Indications, all the same. Precautions and contraindications, all the same. And then our steps are all the same. Again, our explanation, we can do level 1 or level 3 pain relief, just like we could with IFC. So we'd want to explain those, explain how the pre-modulated current works, how it's taking those slightly off frequency to create that beat frequency that we're gonna feel, and how that's usually, again, more comfortable. So then when we get to our settings, we have our level 1, same settings as our IFC. Again, the duration is preset. And level 3, same settings as well as our IFC, and the duration is preset there. So again, that frequency is really technically a beat frequency, but most machines just call it frequency or pulse rate. Electrode placement, you can do all of your different ones except quadpolar. So our monopolar, our bipolar, our bifurcated, just like we could with TENS. And then our length of time, again, 20 to 30 minutes, and our application 1 to 2 times a day for pain. So now you should be able to be playing around and practicing with all of the different waveforms that we've talked about, and you'll have some exercises comparing the different waveforms. So why would I use pre-mod versus biphasic? How do they feel different? Did I like one more than the other? Things like that.